Happy New Year. This is Dr. Story for Story Family Medicine. Reaching out to our members, we are celebrating our 5th birthday. Isn't that amazing to think about? We've been doing this direct primary care clinic for 5 years. It's an amazing thing to us to see how something that started with just Jenny and I in a small clinic and a number of people who said, hey, we like this model of care, has grown to be almost 3,000 patients, 4 doctors. We're amazed by it. It's been a pretty amazing growth. As we approach the 5-year mark and launch into it, we realize there are some things that as we grow, we want to do better. We want to be able to reach out to our patients and not just kind of react to care, which is so important. Obviously, a lot of you use us for urgent care. You welcome the after hours visits with doctors that you know. You really enjoy being able to connect with us, as do we with you. But we want to do better at being proactive, really reaching out and saying, hey, if we haven't seen you in a while, we'd love to have you spend some time with your doctor. Go over your health. Really make sure we're doing a good job anticipating your health, thinking about things that might be worthwhile so that you can live well and be a good steward of your body. Keeping that in mind, membership is something we want to keep reasonable. We want to make sure that we're not getting so expensive that like everything else in healthcare is blowing through the ceiling. So what we have decided is we're going to continue our same rates for healthcare for our membership, $85 for most people, $35 for add-on children, $105 for those that are over age 65. We'd like to keep those prices the same. We're going to do that through a couple of ways. We've already reached out to you asking for some help as we do procedures. Another way that we're going to ask for help is by having a threshold of care. Basically, we think that as we look at our care, that we can provide about 12 visits under that current membership model. For folks who have more needs beyond that, we're going to ask for a small fee per visit after that point. But for most of you, your membership is going to stay the same in 2023, and we think that's amazing. Again, we just want to reach out to you and say we're really thankful that you're part of our care. We recognize this is a unique relationship between doctor and members, and we love how we've been able to grow a community of medical care. This is part of a letter that's going to be reaching out to you. Please note that we're sending you an updated membership contract. It's important that you sign this and review it and read it. It has to do with these recent changes as we move forward into year 6 and Lord willing for generations. We're glad to continue to care for you.